So today's video is about examination of cardiovascular system in pediatrics basically. আমি অ্যাকচুয়ালি রিভাইজ করব যেগুলো এইচওডি স্যার বলেছিলেন আমাদেরকে। তো first of all he started with congenital heart diseases. Now coming to congenital heart diseases, there are mainly two types, right? Cyanotic and acyanotic. Right, cyanotic and acyanotic heart disease. Cyanotic heart disease means the cyanosis is present basically, and acyanotic means cyanosis is absent. So what do you mean by cyanosis? Cyanosis is bluish discoloration of skin and mucosa due to more amount of or high amount of deoxygenated blood or deoxygenated hemoglobin. What happens is that the deoxygenated blood, it comes to the capillary or superficial capillaries, and the skin appears blue. So this is called cyanosis. But there are some conditions. For example, if the patient is severely anemic, the cyanosis will not be that much visible to the naked eye. And if there is polycythemia, for example, due to the hemoglobin is increased in naturally the deoxygenated blood will be more even in normal conditions. And in these conditions, even if the patient has got not such anomalies, there will be presence of cyanosis. The cyanosis are mainly of two types basically, central and the peripheral ones. As the name suggests, peripheral ones are has peripheral causes of cyanosis, and central ones have the central causes of cyanosis. What do you mean by peripheral causes? Peripheral cause means the peripheral vasoconstriction is there, and due to that there is cyanosis. And also it may be due to shock or decrease in blood volume, right? So these are the main causes of peripheral cyanosis. And where is it seen? At the tip of the finger, basically the peripheral areas, tip of the finger, ear lobules, tip of the nose, you can see the peripheral cyanosis there. And what about central cyanosis? Central cyanosis is mainly seen on the oral mucosa part, right? Oral mucosa or tip of the tongue, these are the areas you can see the central cyanosis. And what are the causes of central cyanosis? Central cyanosis has various causes. Central cardiovascular causes, right? Cardiovascular causes, there may be pulmonary causes, right? There are other causes, for example polycythemia is there, right? And there are abnormal hemoglobin, for example methemoglobinemia or sulfahemoglobinemia or carbon monoxide poisoning. In these cases there will be central cyanosis, right? CO poisoning or meth hemoglobin, etc., right? Or HbM also might be there. So coming to the cardiovascular causes of central cyanosis, it may be due to heart failure, or what we are talking about, the cyanotic heart disease, they might cause the central cyanosis, right? Now pulmonary causes, there might be various pulmonary causes. For example, most common pneumonia might be there, asthma might be there, or bronchiectasis might be there. So these may cause central cyanosis, right? So now that was almost all about cyanosis. But now coming to the cyanotic and cyanotic heart disease, what are the most common causes of cyanotic heart disease and acyanotic heart disease? Now coming to the cyanotic heart disease, the most common cause is tetralogy of Fallot, right? There may be transposition of great arteries, right? There may be tricuspid atresia, right? There may be double outlet from right ventricle, right? There may be single ventricle, right? Not right and left, or there may be patent truncus arteriosus, right? They are the main causes of cyanotic heart disease. And what about the acyanotic heart disease? The most common cause is ventricular septal defect. Wait, there are types of ventricular septal defect like the muscular and membranous, but we will be talking about it later. Now there may be atrial septal defect, there may be patent ductus arteriosus, there may be left to right shunt. So these are the main things you should know about congenital heart disease. Now we'll be coming to the examination proper. Okay. Now there are various examination of cardiovascular system. Today we will be talking only about the pulse, BP, and murmur of some cases. Right. Only these topics will be revised today. Basically, sir taught us today. What we will see in pulse, we will check the rate, the rhythm, the volume, right? The characteristics, right? The condition of arterial wall and equality. Now let's talk about rate, right? Rate actually varies with age. If it is normal, it is normal, but if it is increased according for from the standard that is set according to age, we call it tachycardia, and if it is decreased, then we call it bradycardia, right? Let's write it down: tachycardia and bradycardia, right? Tachycardia means increased, bradycardia means decreased. It may be two types, both of them, right? The sinus tachycardia, sinus bradycardia, and tachyrhythmia or bradyrhythmia. If the rate variation is maintained, then we call it sinus, right? If it is regular, rate the change in variation of rate, it is maintained, then we will call it sinus tachycardia or sinus bradycardia. But if the rate is not maintained, then we call it tachyrhythmia or bradyrhythmia, right? Tachyarrhythmia or bradyarrhythmia. There may be various causes of tachyarrhythmia, for example, PSVT, paroxysmal supraventricular tachycardia, or atrial flutter or atrial fibrillations. They are the main causes of tachyarrhythmia. And what about bradyarrhythmia? The complete heart block, congenital complete heart block, or uh, type 2 heart block maybe, or the drug induced, for example, beta blocker is applied, then bradyarrhythmia might be there, right? But what are the regulations of when we will call it tachycardia or bradycardia? For newborn, if it is greater than 200 times a minute, then we will call it tachyarrhythmia or tachycardia. Sorry. And for infant, if it is more than 150, and for adults, if it is more than 120. And what about bradycardia? If it is less than 90 in case of newborn, and if it is less than 60 in case of anyone other than the newborn, then we will call it bradycardia, right? So that was it about the rate. Rhythm might be regular or irregular. If it is irregular, it might be regularly irregular or irregularly irregular, right? And regularly irregular, it is most commonly seen in atrial flutter, and irregularly irregular, it is most commonly seen in atrial fibrillation, right? And there is some physiological phenomena, that is sinus arrhythmia, that is seen during expiration and inspiration. What happens is that during inspiration our heart rate actually increases, and during expiration our heart rate actually decreases. Why that happens? Let me explain. And see, this is our lungs and this is our heart, right? That is right atrium, right ventricle, left atrium, left ventricle. So when we expirate, right, during expiration, the lungs are recoiled. So what happens? The more amount of blood is pushed from the lungs to where? To the left atrium, right? More amount of blood is coming from the lungs to the left atrium. And where does the blood go? From left atrium to the left ventricle, and from left ventricle where? Then aorta, right? So we know when endosteric volume is increased, the more amount of blood is coming to left ventricle, the force of contraction is increasing, and due to the increased force of contraction, more amount of blood is pushed from left ventricle So for that the stroke volume is increased, and also more as the stroke volume is increased, there is increased blood pressure. So two things are happening during expiration. Lungs are recoiled, more amount of blood is coming to left atrium and then to left ventricle. The stroke increased, there is increased force of contraction, and due to that increased stroke volume and increased blood pressure. And due to this increased blood pressure, what happens is that there is activation of the baroreceptor, and they try to decrease the heart rate to maintain the increased blood pressure, or to decrease the increased blood pressure. Another thing is that to maintain the cardiac output, right? The cardiac output is basically heart rate multiplied by stroke volume. If the stroke volume is increased, to maintain the cardiac output, it must be decreased, right? So for these reasons, when so all these are happening during expiration. So what are the things that is happening during expiration? Increased blood in left atrium and left ventricle, increased force of contraction, increased stroke volume, increased blood pressure, and subsequently decreased heart rate. And all of these things opposite happen during the inspiration. Lesser amount of blood come to the left atrium, so decreased force of contraction, decreased stroke volume, decreased blood pressure, and then subsequently increased heart rate. So during inspiration, what we can say, there is our heart rate is increased, and during expiration our heart rate is decreased. So that was all about rhythm. Now come to volume. Volume might be normal, right? uh, Volume might be high or increased, or it might be low or decreased, right? High, there are some causes of high volume pulse, for example, hyperdynamic states, for example chronic anemia, or you are excited, or there might be some fever. In these cases the volume will be high. And where the volume might be low, for example the blood itself is low. Low volume pulse is called thread pulse, and high volume pulse is called bounding pulse, right? So low volume pulse might be there in cases of shock. Blood volume is decreased in shock, right? Or cardiac lesions, more common, sir. Cardiac lesion. Autocardiac lesions, meaning the mitral stenosis or aortic stenosis, or pericarditis maybe, or heart failure, etc., or cardiomyopathies, etc., right? These are the things that may contribute to low volume or thready pulse. And high volume, these are, as I said, fever or anemia, etc., right? Now coming to characteristics, but before coming to characteristics, I will explain condition of the arterial wall and equality, because it will take some more time to explain characteristics, right? So coming to the condition of arterial wall, let me clean this. Now condition of arterial wall, it for neonates mostly it is normal, but it may be thickened in case of arteritis, right? This is the thing you need to know, and more than that is not required. And equality is if there is any delay between the radio or radio femoral between the pulses, right? I mean radial pulses and the radiofemoral pulses, right? What do you mean by that? There is delay between the two pulses. For example, I am checking the radial pulses of both the hands, right? And if there is a delay, a significant delay, if only the delay is significant, then will I realize that there is delay, right? Because if the delay is for microseconds, then I cannot actually appreciate that. So, what are the causes of that delay? If it is radiofemoral delay, right? If it is radiofemoral delay, then there is coarctation after the origin of left subclavian artery, right? After the coarctation, after the origin of left subclavian artery, and if the coarctation is before the origin of subclavian artery, then there will be radial delay, right? Before radial and after radiofemoral delay. So these are the condition. This was all about the condition of arterial wall and equality. Now coming to the big topic, that is the characteristic, right? Characteristics. There are two most important things in characteristics. First one is water hammer pulse. Another is pulsus paradoxus. These are the things you need to understand, right? Pulsus paradoxus I somewhat explained before with inspiration. There is increased heart rate and decreased stroke volume, and during expiration there is decreased heart rate but increased stroke volume. That will also be there in pulsus paradoxus, but there are some other causes that I will explain. But coming to the water hammer pulse first. Let's talk about water hammer pulse. It is also called as high volume collapsing pulse. High volume collapsing pulse. Now let's understand this. Why it is called high volume? Because stroke output is increased. That's why it's called high volume. And why it is collapsing? Because the arteries gets collapsed after the basically high volume pulse. What happens? Let's understand. So, what happens in any anomaly or in any disease, for example, aortic regurgitation, when there is more amount of blood is coming to left ventricle, then due to increased force of contraction and Frank-Starling law, there is more amount of blood is ejected from left ventricle, and so the volume is high volume. So that's why it is called high volume. So what happens? Basically, when increased EDV due to any reason, it may be due to aortic regurgitation or due to maybe patent ductus arteriosus, the stroke output is increased aorta. That is why it is called high volume. And then what happens if stroke output is increased? It is increased blood pressure, activation of baroreceptor, then peripheral vasodilation, and due to peripheral vasodilation there will be decreased in BP, and also the arteries will get collapsed, right? So that's why it is called collapsing pulse. So this is the mechanism of high volume collapsing pulse. It is also called water hammer pulse. Another thing, for example, in case of aortic regurgitation, what happens is the uh, when after one systole, blood is going from left ventricle to aorta, but due to incompetency of aortic valve, blood is coming back from aorta to the LV, right? So what's happening? More amount of blood is coming back to LV. So the EDV is increased once again. And what happens after EDV increased? Same, the volume stroke output will be increased. And there will be another thing, blood is going to the aorta, but just after going to aorta, blood is coming back to left ventricle. So what is happening? The aorta gets collapsed. So in these cases also there will be collapsing or money. Apart from peripheral vasodilation, this is another cause where there will be collapsing. So that is all about water hammer pulse or high volume collapsing pulse. Now let's understand pulsus paradoxus. Actually, I need to draw the same image again. Pulsus paradoxus. I actually explained it beforehand also. That is, it means during expiration our heart rate decreases, and during inspiration our heart rate is increased. Basically, I explained only one reason for that. There is another reason. See, this is heart. What I explained earlier is that during expiration, uh, more amount of blood is coming from the lungs to the left atrium. So left ventricular blood volume is increased, and subsequently the force of contraction is increased, and so on and so on. So that's why the blood increased stroke volume and decreased heart rate expiration. Opposite was happening in inspiration, but also one another thing happens during inspiration. Now let's talk about inspiration. There what happens in inspiration is there is increased negative intrathoracic pressure. So there is increased negative intrathoracic pressure. So what happens due to this? Due to that, more amount of blood coming to right atrium from the upper limb or the lower limb, right? From these two things, more amount of blood is coming to right atrium due to increased negative intrathoracic pressure during inspiration. So what happens if more amount of blood comes to right atrium? There will be more amount of blood in right ventricle, and if the right ventricular volume is increased, the volume of heart is fixed because it is covered with membrane. So left ventricle volume will be decreased, right? If it increases, it will decrease because the total space or total volume is fixed. So if it gets decreased, what will happen to the stroke volume? It will get decreased. What will happen to the heart rate? It will increase. So basic thing is same, the heart rate will be increased, but there are two causes for that, right? One is as I explained earlier, another thing is this. So this was all about water hammer pulse and pulsus paradoxus. There are some other things also, but these are not much required. Now let's talk about another topic. নাও লেটস টক অ্যাবাউট বিপি, বাট বিপি নিয়ে সেরকম করে বলার কিছু নেই। বেসিক্যালি ব্লাড প্রেশার আমরা কয়েকটা পয়েন্ট মনে রাখতে হবে। ফর এক্সাম্পল, যখনই কারোর বিপি চেক করছি, উই উইল হ্যাভ টু চেক বোথ দ্য আপার লিম অ্যান্ড দ্য লোয়ার লিম, রাইট? আর আরেকটা জিনিস হচ্ছে শুধু যে সিস্টোলিক প্রেশার ডায়াস্টোলিক প্রেশার চেক করলাম সেটা নয়, পালস প্রেশারটাও চেক করতে হবে। There are some conditions in which pulse pressure is increased or widened, right? Increased in PP. For example, aortic regurgitation itself, right? Or decreased pulse pressure in case of dengue shock syndrome. Basically, shock এর ক্ষেত্রে decreased pulse pressure দেখা যায়, তো সেগুলো মনে রাখতে হবে। So that was about it in cases of pulse and BP. I will explain murmurs and the airport. So thank you for bearing with me.